What causes asthma? What are the main reasons for its appearance in a modern human? Like the vast majority of most common diseases, there are a number of causes as well, and each case is an individual story. The saddest thing is that the disease factor can be established after it has affected the body, but it is almost impossible to anticipate it. Modern science can only contribute to the prevention of the disease by organizing certain preventive measures and recommending appropriate lifestyles. To a large extent, this concerns hereditary issues. If your relatives of previous generations and any members of your family had or have asthma, then the risk of developing the disease is very high. It is worth noting that asthma itself is not a contagious disease. In this scenario, you need to especially carefully monitor the disease stigmatization and take the necessary measures at an early stage. The type of disease onset should include those risks when you are already susceptible to some kind of allergic disease, and any provocation that cannot be foreseen can lead to the first sprouts of the disease. The two above reasons are among the most specific and predictable. They can even be prevented to some extent. However, the causes of asthma are often unpredictable. Viral respiratory infections, too much tobacco smoke in an enclosed space, inhaled frequently or at great length, strong exposure to flowering plants, in the garden, in the greenhouse, etc., the presence of pets or birds in the house, the smell of perfumes or detergents, and other factors that cause allergies of this kind can, in the most unpredictable way, open those invisible floodgates that can lead to breathing issues. Household mites, fungus, chemicals from everyday work, and car exhaust fumes are also triggers for asthma. Of particular danger are dust mites, which are found almost everywhere. This is especially true when it comes to a person's home living conditions. Carpets, upholstered furniture, bedding, mattresses, soft toys, all of these are possible locations for mites. Those things that are in a musty room, in an unventilated room, are especially at risk. In such cases, of course, the modern achievements of civilization provide for the use of quite specific acariciidal agents or protective hypoallergenic underwear for the prevention and improvement of the room atmosphere. But honestly, who among the broad masses of the far from the wealthy population is aware of this and is inclined to use them? No less dangerous are mold spores, mold fungi, in bathrooms and basements. Their peculiarity lies in the fact that they are not seasonal and exist at any time of the year, as well as plant pollen, which, although it's seasonal, is fraught with a different danger. It is found almost everywhere. This also includes domestic dust, which can also become a trigger for the manifestation of asthma. Finishing the list of respiratory factors that can cause an allergic reaction and bring asthma closer, we should also mention the smells from household cleaners and detergents, scented soaps and fragrance oils, aerosols, glues, and creams. Let's also mention aspirin. It's not like something that smells, but a representative of medications that can also become a trigger for the disease onset. Incredible as it may seem, exercise can also be a trigger for asthma, even though it is intended to improve a person's health. If you have breathing problems, then before you start active physiotherapy, especially sports, you should definitely be examined by a physician. This is especially important if your exercise involves a dynamic nature associated with hyperventilation. Also among the causes of asthma are overwork and stressful situations, malnutrition, as well as factors of unfavorable environmental conditions. The onset of asthma is also associated with the warm season. Recently, scientists have also found a connection between asthma and overweight, but there is no exact evidence for this. Just in such cases, other factors of disordered breathing have not been identified. Asthma symptoms have already been mentioned above: respiratory distress, chest tightness, wheezing, and dry cough. When the condition improves, expectoration begins. To complete the picture, this list should be expanded because with different types and stages of the disease, asthma manifests itself differently. Sometimes at first, subtle signs. A person becomes anxious, moreover, panic develops. And this is not surprising, because if he or she was not previously familiar with asthma attacks, then its first signs can really scare. When asthma becomes chronic, on the contrary, a person develops drowsiness, weakness appears, manifested in reduced pressure. Sometimes the patient may experience lightheadedness. In others, on the contrary, blood pressure rises. The temperature also rises slightly, up to 37.5 degrees. Face cyanosis appears. Veins in the neck become puffy, sweating increases. Sweat becomes cold. However, such signs are already characteristic of the advanced stage of the disease, and if an allergic reaction in a person is very pronounced, then he or she already needs help from outside. At the same time, the recommendations are quite simple, and anyone can help. The main thing is that the person calms down and does not make sudden movements that can aggravate the attack. An asthmatic should not be forced into horizontal position. The attack is more easily tolerated when the person is sitting. Taking warm water in small sips and prescribed medicines, first and foremost in the form of inhalations, can usually stop the attack and return the sufferer to normal. And only if these rather standard first aid measures do not work or the patient's panic increases, calling an ambulance is mandatory. Then, doctors already use forms of strong drug exposure, oxygen masks, and other specialized methods for restoring breathing. Separately, we should focus on the process of treating asthma. Its peculiarity lies in the fact that asthma implies, in fact, a certain mode of life of a person. In this discussion, we will not focus on the extensive list of specialized medicines and drugs that are used in such cases. This is of a very specific nature and is the domain of specialized professionals. Let us dwell only on the most common method of stopping attacks and maintaining the health of the body, such as inhalation. Devices that are used for this type of exposure are called inhalers and are divided into two types: bronchodilators, which are designed to relieve the attack syndrome by expanding the airways, and steroid inhalers. The latter performs precisely the therapeutic function, reducing inflammation of the respiratory tract. For the rapid removal of attacks in an asthmatic, inhalers of the first type should always be at hand. This type of inhaler is a plastic container to which special mouthpiece or mask is mounted on one side, and on the other there is an opening for aerosol injection. Its use allows the medicine to reach the lungs almost immediately and relieve cough syndrome. You can also make your own device, called a spacer in the medical field, which is used at home. This is all the more important because not all patients have the opportunity to quickly use certified industrial inhalers. So, according to the statistics of 2020, on average in the world, only 50% of asthma patients had the opportunity to use bronchodilators, and less than a quarter inhalers of the second type, steroid. Here we are talking primarily about state institutions, the possibilities of which are used by people of medium and low incomes, and these are the vast majority in the world. In paid medical institutions, the picture is much more favorable, but the average statistics take into account all groups of the population. It is worth talking about what the everyday life of an asthmatic is like, how it differs from the worldview of a person who does not suffer from asthma. To be continued in the next episode. Stay tuned.